Good morning, everyone. If we're not speaking, do you want us to use the YouTube link instead?
I think you're fine, Candace.
Okay, thank you.
Still watching for Tom Kelly. Let's see, does anyone have an email or a text that they can text Tom Kelly to find out?
I just did.
Okay, thank you. Derry's trying to get on now, so, okay.
Kathy, I'm watching you, so just let me know.
Okay.
Give me a thumbs up. I'm watching your screen.
I think once we see Tom, we are good to go.
We're good, Kathy.
Mhm. Dean Heath, you can begin when you're ready.
Good morning. I would like to welcome you to the University of Kentucky College of Nursing's Doctor of Nursing Practice and Doctor of Philosophy of Science in Nursing Graduate Recognition Ceremony, celebrating the 2020-2021 doctoral graduates. As a courtesy to the graduates we are recognizing today over Zoom, we ask that you keep your microphones muted during this event. This Zoom session will be closed at 11:35. Zoom participants who exit the event will not be able to rejoin. Should you experience technical difficulties, please join this event on the University of Kentucky College of Nursing YouTube channel. This event will be recorded and is also being live streamed on the UK College of Nursing YouTube page. Now we will begin our recognition ceremony. College faculty members and staff, family and friends, and you, the graduates, it is indeed my honor to welcome you this morning to our virtual recognition ceremony, a significant milestone for 34 DNP graduates and 5 PhD graduates. It is also my honor to extend greetings from President Eli Capilouto and Provost David Blackwell, along with a special invitation to join us at 3 p.m. today at Rupp Arena for the university commencement. Before we begin, there are several distinguished student leaders and faculty on Zoom with us that I would like to recognize for the support they have provided our graduates. Presented on this slide are the graduate nursing activities and advisory committee members from left to right, and also the faculty advisors for GNAC. Brittany Estridge, she is the chair and she's a DNP student. Casey Albertson, she is the chair-elect, a DNP student. Banu Basha is the treasurer, she's a DNP student. Ohud Alusas is a PhD student and member at large. Kendall Feister is a DNP student, member at large. Dr. Martha Biddle, faculty co-advisor, and Dr. Jennifer Miller, faculty co-advisor. Presented on the next slide, from left to right, are senior administrators who help support graduate education. Dr. Terry Linney, Senior Associate Dean, Dr. Sheila Melander, Associate Dean of the MSN and DNP Faculty and Practice Affairs, Dr. Tom Kelly, Associate Dean of Research and PhD Faculty Affairs, Dr. Kristen Ashford, Associate Dean of Undergraduate Faculty and IPE Affairs, Dr. Deborah Mosier, Assistant Dean of PhD Program of Studies and Scholarly Affairs, Dr. Deborah Hampton, Assistant Dean of MSN and DNP Program of Studies, Kathy Collins, Graduate Student Affairs Officer. Later today, the Doctor of Nursing Practice, DNP, and Doctor of Philosophy, PhD graduates will be able to participate in the university commencement ceremony. For today, regardless if you are watching or viewing from your living room or front porch or kitchen table, we are virtually celebrating both groups of graduates who have earned a terminal doctoral degree in nursing, with the DNP emphasizing the scholarship of evidence-based nursing practice and the PhD emphasizing the science of knowledge development in nursing. Doctoral preparation is a critical component of our land-grant, research-intensive university with an academic healthcare center. Even during the COVID-19 pandemic, our graduates have been able to generate and disseminate groundbreaking new knowledge and evidence-based projects applicable to not just individuals, but entire populations and communities. This then allows for the development, utilization, and translation of knowledge across practices and in clinical settings, producing positive, evidence-based, patient-centered outcomes. There is perhaps no other event in the life of a graduate student that compares with the gravity and the symbolism of a hooding ceremony. We hope today's virtual celebration will allow you to imagine the pageantry of the ceremony with its roots in medieval times, dating to the tradition of Europe's first universities. In those early times, the dress of the student and scholar was that of the clergy, and the long gowns were likely worn for warmth. The hoods were worn to keep off rain and snow. In the United States, the academic dress has been continuous since colonial times, having been derived from traditions of our early universities worldwide. As you will see today with faculty, the robe and the hood reflect the level of education, and the color in the hood represents the colors of the university that awards the degree. As you know, the colors of the University of Kentucky are blue and white, but you may not know that the colors were adopted in 1892. The color for nursing is apricot, as determined by the nursing faculty at Yale in 1927, and it too has been a continuous tradition since that time. Please know, as we imagine you in full regalia, that we are exceedingly proud of your accomplishments and wish you the very best in your new journey as nurse scientists, scholarly advanced practice nurses, committed educators and mentors, and executive nurse leaders. Your years of hard work during incredibly challenging times have finally paid off. You sacrificed a lot to earn your degree while rising above the challenges presented by the pandemic and forging your path forward, saving lives, transforming communities, and inspiring hope throughout the Commonwealth and beyond. This is the time that I would normally ask all of our faculty and staff to stand to be recognized for their tireless dedication for the success of our graduates. I know they do this out of a true passion for mentoring our students to become the next generation of nurse leaders, scholarly practitioners, and researchers. Our graduate students and their advisors form a very special bond while working together during the doctoral program. It's a bond that will last well past this day. Thus, even our virtual recognition ceremony is special for both our graduates and their faculty advisors and mentors. So join me in giving our faculty a thumbs up. And last, but certainly not least, I extend my welcome to all the family and friends who have joined us today. We thank you for your love and support of these graduates and join you in celebrating their achievement, earning the highest degree awarded by the University of Kentucky, an accomplishment for which you can be very proud. Thank you and congratulations again. At this time, I would like to introduce Dr. Tom Kelly, Associate Dean of Research and PhD Faculty Affairs, who is standing in for Dr. Deborah Mosher, Assistant Dean of PhD Program and Scholarly Affairs. Dr. Kelly will recognize the Doctor of Philosophy and Nursing degree candidates. Dr. Kelly, would you like to say a few words about the PhD program?
Thank you, Dean Heath. Dr. Moser sends her greetings and congratulations to all of our graduates. The PhD degree confers the status of Doctor of Philosophy. The term philosophy is translated from its original Greek meaning, love of wisdom. The PhD degree, as Dean Heath mentioned, is the highest research credential that is offered in most disciplines and is bestowed only in those cases in which the recipient has been able to demonstrate the ability to conduct a program of scholarly work that results in a significant advancement or enhances the wisdom, if you will, in their field of study. The students who are receiving their PhD degrees today have achieved this distinction. Through their scholarly efforts, they have contributed to expanding wisdom in the academic discipline of nursing. The titles of their PhD projects will provide a little insight into the significant advances in knowledge that they have contributed through their efforts during their PhD programs. And while PhD nurses are able to assume many important roles in society, first and foremost, they are scientists, researchers with a love of generating new knowledge upon which others can build or that directly impacts the health of individuals, families, and communities by preventing and managing illness. I will now introduce each of the students' advisors who will in turn introduce their students and tell you a bit about the students and their work. First, I would like to introduce Dr. Kristen Ashford.
Thank you, Tom. It is my pleasure to present Martha Monroe. Martha graduated from UK with her BSN in 2006, and I served as her OB clinical instructor. Even then, she was quite inquisitive, and I knew that she had a talent and passion to become a leader in maternal child health nursing. Fast forward a decade later, and Martha reached out to me to talk about the PhD program. We met in Starbucks with her young daughter, Mary, and within a year, Martha was enrolled in the PhD program. Martha was selected in the prestigious Robert Wood Johnson Foundation Scholars in Nursing program, a highly rigorous program geared to build the next generation of PhD nurse leaders. Martha successfully completed the program in 3 years. Throughout the program, Martha was able to successfully balance work and academics and service. As a wife and mother of 3 young children, Martha was focused on advancing the science of exclusive breastfeeding. Her project systematically examined facilitators and barriers to exclusive breastfeeding initiation in healthcare systems. Martha also engaged in numerous regional and national conferences disseminating her impactful work. I'm very pleased to announce Dr. Martha Monroe.
Thank you, Dr. Ashford. Next, I would like to introduce Dr. Ellen Hahn.
Thank you, Tom. I'm really happy to be here today to introduce Kimberly Marie Riddle. And her project was Risk Factors for Workplace Sexual Harassment in Female Truck Drivers. Kim was a pre-doctoral trainee in our Occupational and Environmental Health Nursing Training Corps, which is an NIOHS, so a National Institute of Occupational Safety and Health funded Central Appalachian Regional Education and Research Center, which is a mouthful, but it's a very prestigious traineeship. Kim earned her Master's of Science in Nursing in 2012 from Western Kentucky University. And since starting her PhD, Kim has served as instructor of nursing at Western Kentucky University. And in 2015, Kim was recognized by Sigma Theta Tau, which is our nursing honorary, the Kappa Theta chapter, with the Excellence in Nursing Practice Award. And indeed, the findings of her important work have caught the attention of several national women's trucking groups in the country. So I want to congratulate Kim for successfully completing her PhD. Congratulations, Dr. Riddle.
Thank you, Dr. Hahn. And next, I would like to introduce Dr. Terry Lenny.
Thank you, Dr. Kelly. It's my privilege to recognize Dr. Raina Rochelle Rahman, whose title of her dissertation was "It Matters Who You Live With, the Relationship of Living Arrangements to Medication Adherence in Patients with Heart Failure." I had the pleasure of working with Dr. Rahman after her original advisor retired, and it has been a great experience. As an advisor, it's always an enlightening surprise when students come up with an idea for a dissertation that at first hearing seems evident and certainly something that has already been investigated. And then to learn from them that it isn't all that self-evident and we actually don't know that much about the topic. And that was the case with Raina's dissertation topic. We had always assumed that people with heart failure who live with someone have better medication adherence than people who live alone because they have better social support. The 3 studies in her dissertation demonstrated that the relationships among living arrangement and social support with adherence is far more complex and depends on who the person lives with, the type of social support provided, and the presence of other factors like financial status and depressive symptoms. She has raised awareness that we need to have a much better understanding of living arrangements of people with heart failure if we are to be effective in helping them improve their medication adherence. While completing her dissertation, Dr. Rahman worked as a project director for several studies in the Rich Heart program. Since completing her PhD, Dr. Rahman has continued to be a valued member of the Rich Heart program as a research study project director, and now is helping oversee the implementation of a major new clinical trial. Congratulations, Dr. Rahman.
Dr. Lenny, would you also introduce Dr. Lynn?
Yes, so I have the privilege of recognizing 2 of Dr. Moser's advisees. And the first one of those advisees is Dr. Chin-Yen Lin. The title of her dissertation was Responses to Symptoms Among Patients with Heart Failure. Here is what Dr. Moser wrote about Dr. Chin-Yen Lin. She is one of our stellar international students, having come to us from Taiwan. She has worked during her PhD program to become an expert on symptom experiences of patients with heart failure. For her dissertation, she completed a complex project in which she personally enrolled, evaluated, and interviewed more than 100 hospitalized patients and prospectively investigated the factors that precipitate their admission. This is a difficult line of work, yet an extremely important one. All such previous studies have been done retrospectively by examining medical records without considering patient's view or patient's conditions like depression, lack of social support, or ability to adhere to medication adherence that might precipitate hospitalization. Dr. Lin has presented her exceptional research at the American Heart Association's annual scientific sessions and at other important venues. Her dissertation consisted of 5 instead of the usual 3 publishable papers, and she has already published 3 of them in high-quality journals and has submitted the remaining 2. Dr. Lin was a graduate research assistant during her PhD program, offering outstanding service to the Rich Heart team, and she has recently started a postdoctoral fellowship. She is also a wife and a mother during her PhD, and she successfully balanced her many roles with aplomb, graciousness, and humor. Congratulations, Dr. Lin. Dr. Christine Willemaitis, we want to congratulate her as well. The title of her dissertation was Complications in Cardiac Surgery. Dr. Moser says that she has been delighted to present to us a double doctorate, Christine Willemaitis. Dr. Willemaitis has a DNP when she came into the PhD program and has now earned a PhD. She faced and overcame multiple serious personal challenges and persevered to obtain her PhD. She conducted an ambitious group of studies using a big data approach to examine risk factors for and outcomes from complications suffered during cardiopulmonary bypass for coronary artery bypass surgery. I have also long admired Dr. Willemaitis for her work as a psychiatric nurse practitioner. She, who works with a very vulnerable population of individuals with LVADs who are suffering from serious mental health problems. Few people are able to work with such a persistently demanding population, and Dr. Willemaitis does this with great success. Dr. Willemaitis lives on a farm where she maintains a large and very special menagerie that includes horses and many rescued pets. She has never met a rescue that she wouldn't take in. These rescues include some of the very vocal dogs who were always very jealous of her time spent with others on Zoom calls. Congratulations, Dr. Willemaitis.
Thank you, Dr. Lenny. At this time, please join me in giving all of our PhD graduates a virtual thumbs up. At the end of the event, we'll open up our mics for an actual round of applause. Thank you. At this time, I would like to introduce Dr. Sheila Melander, Associate Dean of MSN and DNP Faculty Affairs and Practice. Dr. Melander.
Thank you, Dr. Kelly. It's my pleasure to begin by saying just a bit about the Doctorate of Nursing Practice. The first Doctorate of Nursing Practice program was started at the University of Kentucky in 2001. The DNP is a degree that is designed for nurses seeking a terminal degree that will provide them with increased clinical knowledge and expertise directly related to a specialty within nursing. The DNP is also chosen by nurses seeking some of the highest level positions in clinical nursing leadership, administration, and management. Nurses who have completed the DNP are making significant impacts on quality and effectiveness in our healthcare systems through their contributions in clinical practice, advocacy, health policy, implementation, and evaluation of evidence-based practice, and through their contributions to nursing education. DNP programs across the country are distinguished by the completion of a specific project designed to demonstrate the mastery of an advanced specialty. The final DNP project must address a critical gap in patient and/or system needs and serves to document the students' educational experiences while summarizing their growth in knowledge and experience. We are very excited about the work these students have done and know that it is just the beginning of the many contributions they will make to our profession. Our graduates are prepared to be the future leaders in our healthcare arenas and are up to the challenge through their work and preparation. I will now introduce each of the graduates' advisors who will introduce their students and tell you just a bit about their work. So to recognize the psychiatric mental health nurse practitioner graduates, I would like to introduce Dr. Evelyn Parrish.
Thank you, Dr. Melander. It's an honor for me today to get to discuss and introduce you all to Erin Harris. Erin's project was a pilot project assessing using the outcomes of COPE, which is a cognitive behavioral therapy program in patients awaiting LVAD implantation. Erin graduated from the University of Kentucky in 2013 as a second degree student to obtain his BSN. He immediately started his career as a staff nurse in the cardiovascular ICU unit across the street from us. He attained and has maintained certification as a certified critical care registered nurse since 2015. And something I'm excited for Erin about and really exemplifies who he is and the care that he has for everyone. He was recently awarded a Blue Jacket from the University of Kentucky Healthcare for helping transport a priest to administer last rites to a dying ECMO patient during the ice storm in March of this year. In 2018, he was awarded the MJ Dixon Quality Nursing Care Award from UK Healthcare. Erin continues to work in the cardiovascular ICU and is very hopeful based on the results of his project to further develop a role in the cardiac line to offer and be the first psych mental health nurse practitioner on that line. And I know folks are working on that. So this is one of the outcomes and changes that Dr. Melander indicated before that can come from our students' projects. So Dr. Harris, congratulations. And it was a pleasure serving as your advisor. Thank you.
Thank you, Dr. Parrish. Next, to recognize the pediatric nurse practitioner graduates, I would like to first introduce Dr. Morgan Chernacki.
Hello, and thank you, Dr. Melander. I would first like to recognize Dr. Brooklyn Johnson. Dr. Johnson's DNP project was titled The Effect of a Child Passenger Safety Educational Intervention on UK Pediatric Residents' Self-Reported Knowledge, Beliefs, and Anticipatory Guidance Behaviors. Dr. Johnson's experience as a bedside pediatric ICU nurse has made her passionate about preventing illness and injury in children, and she'll do very well as a PNP. We are very proud of you for your accomplishments, and I know your mom is smiling down on you with pride today. Congrats, Dr. Johnson. The best is yet to come.
Thank you, Dr. Chernacki. Next, it's my pleasure to introduce Dr. Leslie Scott.
Thank you, Dr. Melander. I would like to introduce everyone to Dr. Adkins. The name of her, or the title of her DNP project, was Identification of Infant Feeding Practices in Eastern Kentucky and Southern West Virginia that correlate with high weight for length. I expect great things from Dr. Adkins in the near future. She started her nursing career with a BSN from the University of Tennessee Health Service Center. She's currently working at the Charleston Area Medical Center, Women and Children's Hospital Emergency Department. She was the 2018 Sigma Theta Tau Leadership Award recipient. And in 2021, she received, she was appointed a student policy intern with the American Association of Colleges of Nursing. I'd like to congratulate you on all your hard work, and I'm very proud, and I'm pleased to work with you. Excuse me. Next, I have Dr. Allison Berger Reynolds. The title of her project was Anxiety Screening in Children and Adolescents with Type 1 Diabetes using the GAD-7 tool. Dr. Reynolds, she received her bachelor's degree from Bellarmine University in 2014, and she's currently working at Norton Children's Critical Care Center. She was the 2000 recipient of the Silver Award at Norton Children's for her nursing care. And her project has really been able to bring awareness to the anxiety in adolescents and other children with type 1 diabetes, and really help better identify program needs. So I'm very excited for the work that she's done, and I'm proud of the work she's done. On a side note, she conducted her project and completed her DNP work while she had 2 children during the process. So I admire all your hard work, and I'm very proud of everything that you've done. And congratulations.
Thank you, Dr. Scott. To recognize the executive leadership graduates, I would like to first introduce Dr. Karen Butler.
Thank you, Dr. Melander. It's my pleasure to present Becca Charles. Becca's clinical project was entitled The Effective and Acuity Adaptable Unit on Efficiency in Non-Critical Trauma Patients. Becca has been at UK Healthcare for 25 years. She started in the OR as a surgical technologist with a specialty in trauma and orthopedics. She began her nursing career in the trauma ICU. Becca's first venture into leadership was when she took the assistant patient care manager position in trauma surgical services. She became the patient care manager 4 years later. Trauma has always been her passion. Becca has won several awards over the course of her career. The most recent was the SAHA Award for Clinical Support in 2019. Because Becca enjoys operations so much, she felt that setting her path for growth around executive leadership was a good fit, and it certainly has been that for her. She has made so many positive changes as a leader at UK Healthcare and is a valued and respected member of their nursing leadership team. Working with Becca has been such a delight. She is smart and hardworking and has one of the very best senses of humor I have ever known. No matter the situation, she takes it in stride with a smile and goes forward. She has been an exemplary DNP student and is moving on to more great things in nursing leadership. Congratulations and best wishes, Dr. Charles. It is also my distinct pleasure to present Taylor Collins. Taylor's clinical project was entitled The Impact of a Change in Leadership. Taylor has been a nurse for 12 years. For most of this time, she's been a bedside nurse, but she has also worked as a clinical nurse expert and an assistant director of nursing. She has a particular love for the cardiothoracic setting and patients. In the middle of her DNP program, Taylor moved to Fort Worth, Texas. Despite the challenges of moving and creating a new home with her husband and 3 very young children, she continued to excel academically. In fact, she never even skipped a beat. She currently works on a progressive care unit and looks forward to moving into a nursing leadership role in Texas. Taylor has been a committed and passionate DNP student. She has worked very hard to succeed while balancing all of the other demands in her life, as well as through major life changes. Taylor is sure to make a major impact in nursing, whatever she chooses to do, and she can do anything she wants. Congratulations and best wishes, Dr. Collins.
Thank you, Dr. Butler. It's now my pleasure to introduce Dr. Deborah Hampton.
I'm happy to present Holly Chitwood. Holly has her DNP in Clinical Leadership in Healthcare. The title of Holly's project is the evaluation of an amino acid oral rehydration solution titled InterAid to improve quality of life in solid tumor cancer patients by reduction of chemotherapy-related diarrhea. Holly completed her associate degree and bachelor's degree at Eastern Kentucky University. She completed a master's as a family nurse practitioner at Lincoln Memorial University, and then completed her adult gerontology Nurse Practitioner Certificate Program at University of Kentucky in 2017. Holly then began in the MS-DNP Clinical Leadership Program at the College of Nursing. Holly started her nursing career as a staff nurse in the Children's Hospital at UK Healthcare and worked there for several years. And Holly currently works at the Markey Cancer Center as a nurse practitioner. In addition, Holly teaches in her undergraduate program with a focus on pediatrics. Holly has been very successful with scholarship during the MS-DNP program. She has had several presentations and has published 3 articles in peer-reviewed journals. And as evidenced by Holly's presentation and her work, she has a strong work ethic. She's very intelligent, and she demonstrates her dedication and passion to nursing through all that she does. Congratulations, Holly, and it's been a pleasure to work with you.
Thank you, Dr. Hampton. Next, it's my pleasure to introduce Dr. Julie Marfell.
Hello. It has been my great pleasure to work with Dolores Polito and her work that she has done on a population assessment to determine eligibility for birth center care at the University of Kentucky Midwife Clinic. Dr. Polito is a graduate of Case Western University with her MSN and her certificate in nurse midwifery from Frontier Nursing University. She has been active in the American College of Nurse Midwives and is on the board of directors for the affiliate here in Kentucky. Dr. Polito's determination and passion for midwifery has been evidenced throughout her program of study for her DNP here at the University of Kentucky College of Nursing. Dr. Polito has presented several times specifically about birth centers and the importance of being able to give women a choice of where they give birth here in the state of Kentucky. Whether you may not know it, but Kentucky is one of the only states in the United States that does not have a birth center available for women to have their babies. Dr. Polito has been the lead midwife at the University of Kentucky Midwifery Clinic and continues to practice as a nurse midwife. Dee, it has been my absolute pleasure to work with you during this period, and I'd like to share a little wisdom with you if I can. As you begin your life's chapter, I have some words of wisdom from 2 of the mothers of midwifery for you. The first is from Ruth Lubick. Begin with the needs of the people you serve. Base your design for change on the best science possible. Overcome the fear associated with leadership, and remember the people that you serve are your strength. I also have a quote from Kitty Ernst. All healthcare begins with the mother. Dee, congratulations on a job well done, and I look forward to standing beside you when the first birth center opens in Kentucky.
Thank you, Dr. Marfell. It's my pleasure next to introduce Dr. Karen Stefaniak.
Thank you so much, Dr. Melander. I have 3 wonderful new doctors to tell you about, graduates of our DNP program. The first one is Corey Arena. Her project was improving human papillomavirus vaccination rates among Kentucky adolescents. Corey received her BSN from UK and an MSN from EKU. She is currently an advanced nurse practitioner in the UK Department of Pediatrics in the Division of Adolescents. Corey's a lifelong learner, and she's just never satisfied. She never feels like she knows enough or can do enough for her patients. Therefore, while completing her DNP program, she decided she would also engage in another program. So she's currently completing a certificate program in psych mental health at UK. She will complete that program in 2021. And who knows what is next for Corey. I have a feeling there will be many, many more activities that we will be hearing about. Congratulations, Dr. Arena. The next young lady that I would like to introduce you to is Kimberly Blanton. Kimberly Blanton's project was the effects of mindfulness practice on nurse leader resilience, decreasing stress and improving nursing through mindfulness practices. She received her BSN from Moorhead and an MSN and an MHA from Phoenix. She's had numerous leadership roles, and I've had the pleasure to work with her during most of those. She received the Diana Weaver Award in 2015, and she's acknowledged throughout the organization as a leader. She's currently the Nursing Operations Administrator at UK Healthcare, where she oversees numerous inpatient and diagnostic product lines. As a matter of fact, just a couple of weeks ago, she told me about another one that she was now going to have the opportunity to work with. And I said, how can you do that? And she said, I work with a great team. So I think that says a lot about her. In addition to these product lines, she is the UK Healthcare Enterprise Director for Infection Prevention and Control. So I guess it goes without saying that during her DNP program, she also has been very, very involved in the COVID-19 pandemic. And all of us have waited daily for what she would tell us, how she would guide us through what we have all had to endure, and we appreciate her help. So congratulations, Dr. Blanton. The next person I would love to introduce you to is Dr. Roxanne Gall. Her project was positive reflective journaling as a tool for managing stress and promoting a healthy work environment in nursing academia. She received a BSN and an MSN from UK. She is a clinical nurse specialist and an advanced nurse practitioner. She's currently practicing at a preventative care clinic at Turfway Horseman's Wellness Center. She also is a faculty and concentration coordinator in the Adult Acute Care Nurse Practitioner program, in the DNP program at NKU. Roxanne is an advocate for the underserved, and she has been tireless in her volunteer efforts to that end. She's worked with women, with all various sorts of folks in various populations that were underserved and needed her help. And she has been very active throughout her career in serving those folks. So congratulations, Dr. Gall. We look forward to seeing what you will do next. Thank you very much. Sheila?
Thank you, Dr. Stefaniak. We will now recognize the family nurse practitioner graduates. And I would like to first introduce Dr. Sharon Locke.
Thank you, Dr. Melander. I'd like to introduce Dr. Ashley Valance Hall. Ashley's project was entitled Evaluating the Effect of an Electronic Health Record Patient Portal on the Management of Hypertension. I've been honored to be Ashley's advisor for 5 years, and I was her preceptor for her first clinical experience in our College of Nursing clinic in Wilmore. From the beginning, we met twice a semester, so I got to know Ashley very well. We talked about the courses she needed to take and her interests for her project. But we also talked about her Yorkie, Harlow, and my dogs and cat at the time, and planning for her wedding. Ashley really planned everything perfectly, and she and her husband are expecting their first child this summer. So congratulations, Dr. Hall. I've really enjoyed working with you the past 5 years, and I wish you all the best in life and in your career.
Thank you, Dr. Locke. It's my pleasure next to introduce Dr. Julianne Osage.
Thank you. I'm going to say a few words about Dr. Asal Mori. The title of her project was Sustainability of a DNP QI Project on BMI Screening and Weight Management Documentation in Primary Care. Dr. Mori is an amazing person and has done a fantastic job in the DNP program. Her project on sustainability is the first of its kind that we are aware of. And she took the idea and did not look back and produced a well-done scholarly project that we hope you will be reading about in print in the next year. Asal spent a third of her life in Iraq, a third of her life in Mexico, and a third of her life in the US, and subsequently is fluent in 3 languages and taught herself English, which is no small feat. She has degrees from JCTC and Indiana University Southeast, and has consistently received awards for high academic achievement in all of her academic endeavors. When I observed Asal in clinical this past year, I saw that she was a natural. She's interested in working with the underserved and will be a great addition to any practice that is lucky enough to have her. Congratulations, Dr. Mori. I'm happy to also say a few words about Dr. Shelby Roberts. The title of her project was The Impact of Identifying and Addressing the Social Needs of Patients with Type 2 Diabetes in a Primary Care Clinic. Dr. Roberts is truly one of a kind. She inherited me as an advisor about a year ago and did not even flinch about getting a new advisor in the middle of her project. She continued on with the project to assess social determinants of health and diabetes distress in patients in an underserved area of Lexington. And to be honest, I marveled at her initiative and drive to continue that project. Dr. Shelby has a heart for working with the underserved also, and is interested in participating in the shoulder-to-shoulder medical brigade to Ecuador at some point when that is started up again. Dr. Roberts was the 2019 recipient of Evolving Leaders Level 3 Award from Baptist Health in Lexington. Shelby has done stellar academic work in this program and now will be a 2-time graduate of the UK College of Nursing. Congratulations, Dr. Roberts.
Thank you so much, Dr. Osage. Next, it's my pleasure to introduce Dr. Elizabeth Tovar.
Thank you, Dr. Melander. It's my pleasure to talk about Dr. Lauren Motto. The title of her project is Improving Assessment, Documentation, and Ordering of Diabetic Retinopathy Screenings in a Primary Care Clinic. For her project, Lauren worked with an interprofessional team of healthcare providers to improve the diabetic retinopathy screening in primary care. She worked with the team. She led them in identifying facilitators and barriers to diabetic retinopathy screening in the clinic. And based on the information that she obtained, she implemented an evidence-based reminder system to improve the screening. And it was effective. It was a pilot. It was successful. And the clinic has continued to use that and build on that. So talk about bringing evidence to practice and making a difference. She did in this setting. So Lauren has been a nurse for 7 years. She graduated from Bellarmine University. She started out psychology thinking she wanted to be a therapist. And then her senior year, she decided she wanted to do nursing. And we're so glad that she did. She's been working in the intensive care setting at Norton for 7 years. She's been recognized as a Norton Scholar. She's a Daisy Award winner and has been nominated for Nurse of the Year and additional Daisy Awards multiple times. So excellence in her work as a bedside nurse. And I'm sure she'll be just as excellent as an advanced practice nurse. Good news, she's already passed her certification exam on the first try, and she starts her first job as an APRN next week at the Little Clinic. So we're so excited for you, so proud of you. It really has been a pleasure to work with you, Dr. Motto, and we wish you all the best. So congratulations. Okay, and Dr. Alex Wiesner, it's also my privilege to talk about her. The title of her project was Evaluating the Use of Telehealth to Manage Hypertension in the Primary Care Setting. This was another interprofessional DNP project in which she helped to implement an evidence-based strategy to use telehealth to improve management of hypertension, in which the patients would communicate through an EMR portal, giving their home blood pressure logs, and then the provider would communicate what to do as a result of these logs, and to evaluate the feasibility of this, how it worked, and if it could be continued on a larger scale. And so the physician she worked with, it worked well, and now he's implementing it throughout the entire clinic. So another project that was really made an impact. She has been a nurse for 5 years, working at St. Elizabeth the whole time in the intensive care unit. And in talking with Alex about how she decided to take the FNP route, she, in the critical care setting, she saw all the patients with the chronic illnesses and the complications that came, that occur as a result of that. And so she really wanted to focus on the health promotion, illness prevention, primary care aspect of it. So she's in the right place, about to graduate. She'll be taking her certification exam this summer. And she's getting married. So this is a huge year for you. I'm so excited for you. I'm so proud of you. It's been a real pleasure working with you. And we just wish you all the absolute best. So congratulations, Dr. Wiesner.
Thank you, Dr. Tovar. Now we're going to switch to recognize the adult gerontology clinical nurse specialist graduates. And it's my pleasure to introduce Dr. Martha Biddle.
Thank you, Dr. Melander. It's with an honor that I introduce you to Shannon King, who has completed the degree components for the adult gerontology clinical nurse specialist. Shannon completed her work in December, and her final project was called Don't Just Check the Box, Check Your Athlete's Heart, adding a 12-lead EKG to pre-participation screening to identify high risk of sudden cardiac arrest in athletes. So Shannon implemented this project in a very difficult time in this world, and we had some rearranging that we had to do, and Shannon was very self-motivated and directed. And so she not only worked with the local community, Fayette County High School, but she also found an industry leader that was doing pre-participation screening of athletes. And so Shannon worked together with our community and the industry, was able to complete her project, and has also been recognized for her work, and actually will be presenting her final project to Sigma Theta Tau biennial convention in November in Washington, D.C. So it's been really great to work with Shannon. I've been honored to be her advisor. I'm honored to be her friend. I will tell you one little memory that we have together when we took a road trip to Hazard for a weekend, and we worked in the remote area medical clinic. And that was a fantastic experience, not only as a colleague, but as a student mentor. We just had a great time doing great things in that underserved community. Shannon has recently secured a position as a clinical nurse specialist for diagnostic and interventional services at University Healthcare. And so I'm really proud of her for that, and look forward to the new generation of clinical nurse specialists with Shannon leading the way. So congratulations, Dr. King.
Thank you, Dr. Biddle. Dr. Biddle has served in 2 of our specialty tracks. So we're going to switch now to our adult gerontology acute care nurse practitioner track, where I'll first introduce Dr. Biddle again.
Thank you, Sheila. My student, Jessica Casido, was a student that I started working with when Dr. Carol Thompson retired. And so Jessica completed the adult gerontology acute nurse practitioner program this semester. And her final project was a multifaceted intervention to reduce low value care in the medical ICU. Jessica did an outstanding job because her work was being done in the medical ICU during COVID on the unit that was taking care of nothing but COVID patients. And so she was able to complete her project and get some great data and share that with her committee. And we look forward to that work being published. So she has been very instrumental in getting and helping providers understand practice behaviors related to her project, and also helping the providers and the nurses there understand that unnecessary diagnostic testing can actually harm the critically ill patient. So Jessica plans to continue working in the critical care setting as an advanced practice provider. So I'm very proud to have worked with Jessica, and congratulations to Dr. Casido on your DNP degree completion.
Thank you, Dr. Biddle. Next, I'd like to introduce Dr. Melanie Harden-Pierce.
Thank you, Dr. Melander. It is indeed my privilege to be able to talk to you and introduce 6 new doctors. And I just want to say ahead of things is that all of these DNP completers and graduates, new doctors, will be board eligible to become certified as an adult gero acute care nurse practitioner. I know they all look forward to that. The first individual that I would like to recognize is Mr. Joshua Caldwell. Joshua earned his BSN from the Northern Kentucky University in 2016. And it's been a pleasure and an honor for me to be his advisor on his DNP journey that he began in fall of 2018. And like most of our DNP students, they are also, studying to earn their doctorate, but they're also working full-time in clinical practice. So during the time that Joshua was working on his DNP, he was also achieving professional nursing success in the St. Elizabeth Hospital system as a critical care nurse leader. Dr. Caldwell is an officer in the Kentucky Army National Guard Nurse Corps, and he's also a father to his 13-year-old son, Coleman. We are grateful for his service to our country, and we look forward to his future accomplishments as a doctorally prepared advanced practice nurse leader. His DNP project, titled Evaluation of a Spontaneous Breathing Trial, Extubation Protocol on Patient Outcomes, has impacted ventilator liberation practices and outcomes, and as well as our understanding of how evidence-based protocols can and should be implemented effectively. So congratulations, Dr. Caldwell. Okay. The next individual that I want to honor is Dr. Chereshneva, Christina Chereshneva. Dr. Chereshneva was born and raised in the Ukraine. And at age 20, she set out on her own, leaving her family. And she traveled to the United States, where she came to New York. And she earned her associate's degree in nursing in 2012. She decided that she wanted to join the United States Army, where she served in multiple places around the world, in Europe, as well as here in the United States, working entirely with public health support, ensuring safe food and water for both military and public consumption. She also earned her her bachelor's degree during that time in New York City as well. After retiring from the military, Christina began her DNP journey with us in the fall of 2017, finishing last summer, right in the midst of the pandemic. Her DNP project, titled Evaluation of Efficacy and Safety of Adult Diabetic Ketoacidosis Treatment Protocol at a Tertiary Healthcare Center, has certainly increased our understanding of how these evidence-based protocols can prevent complications such as hypoglycemia, can promote DKA resolution, and therefore shorten ICU lengths of stay. Congratulations, Dr. Chereshneva. The third doctor I want to speak about is Dr. Rachel Crowley. Dr. Crowley is a flight nurse currently, right now, with PHI Air Medical. And she recently transitioned to the pre-hospital environment from an inpatient acute tertiary care environment. So basically what that means is that in the beginning of her DNP study, not only did she receive a new advisor, which is me, after Dr. Carol Thompson, her initial advisor, retired, but she also changed her career and therefore changed her DNP project. Her initial project was really geared at the track and trigger system with sepsis identification at UK Healthcare. So she switched jobs and she entered flight nursing. She earned her BSN from Eastern Kentucky University in 2013, and she began her DNP journey fall of 2015 in the adult GERI acute care nurse practitioner specialty area. Dr. Crowley is a board certified critical care nurse. She's also board certified flight nurse. Her DNP project titled Safer Airway Management, Evaluating the Effectiveness of Checklist Implementation on Reducing Peri-intubation Complications in an Air Medical Transport Service, has resulted in better understanding of how to improve quality and safety outcomes during field and transport airway management. We look forward to her continued accomplishments as she integrates advanced practice nursing into the pre-hospital acute care area. Congratulations, Dr. Crowley. I'm very proud of you. Next, I would like to speak to Dr. Emma Kroger. Dr. Kroger, she bleeds blue. She is a Kentucky girl. She grew up in Versailles. She earned her BSN from University of Kentucky College of Nursing in 2017. And since that time, she's become an accomplished intensive care unit nurse in the medical ICU unit right here at UK Healthcare Chandler Medical Center. Emma wasted no time at all in returning back to school to us, her alma mater, to earn her Doctor of Nursing practice and become an acute care nurse practitioner. Her DNP project titled End of Life Nursing Education Consortium to Improve the Gap in Palliative Care Education has immediately impacted our understanding of effective models for educating pre-licensure nursing students to provide evidence-based care to persons who are at the end of life. I inherited Emma also from Dr. Carol Thompson, and it's been a pleasure to work with her on her project. In fact, the curriculum that she developed for her scholarly work has been adopted by our own undergraduate nursing program at the University of Kentucky. So we really look forward for more from Dr. Kroger. Congratulations. Dr. Nicole Smith. She has been a pleasure, I tell you. Very motivated, very detailed. She makes me look really good. She graduated with her BSN from the University of Kentucky in 2013. She became board certified in critical care nursing during her long and accomplished nursing career in the CVICU right here at UK Chandler. She's just one of the many CVICU nurses who has come to our program to earn their doctorate of nursing practice. There must be something in the water there with that CVICU. I'm telling you, and it might be their manager, D. He is amazing. He really does put his nurses forward. Her DNP journey began fall of 2016, and her project titled Device-Related Concerns Pertaining to Primary Caregivers of LVAD Patients. Nicole, her project was very unique in that it tiered off of a previous student's project and resulted in further increasing impact and our understanding of the LVAD patient's caregivers' unique concerns and needs. So she basically expanded investigation into the unique needs of LVAD patients to include their primary caregivers. Dr. Smith intends to publish her work soon and seek an advanced practice role in her specialty. Congratulations, Dr. Smith. Lastly, I want to speak to Dr. Catherine Wilhelm. Katie earned her BSN from Indiana Wesleyan University in 2015. And since that time, Dr. Wilhelm has built a distinguished critical care nursing reputation and career, again, in the CTICU, right here at UK Healthcare. She also is a board certified critical care nurse. She began her DNP journey with us during the fall of 2017 to meet her goal of becoming an acute care nurse practitioner. For her DNP scholarship, Katie examined the relationship between preoperative frailty and postoperative outcomes after left ventricular assist device implantation. Her work has immediately impacted our understanding of the risks of frail LVAD patients and the need to assess for frailty and to treat and mitigate the complications of frailty, of preoperative frailty, in order to improve long-term patient outcomes. Congratulations, Dr. Wilhelm. I look forward to more from you in the future. That concludes my comments, Dr. Melander. Thank you.
Thank you, Dr. Harden-Pierce. Well, last but not least, I would like to address my DNP advisees. So Emily Corsentino, Emily's project was home point of care INR testing in left ventricular assist device patients, a clinical evaluation. Emily has been a nurse for almost 5 years in the cardiovascular ICU at the University of Kentucky. She received her bachelor's degree in nursing from the University of Louisville in May 2016. Emily began her studies in our DNP program in 2016, and during her time in the program, she married her husband, Kenny, and they had a beautiful baby girl, Mia, in 2020. So congratulations, Dr. Corsentino. Next, I have Deanna Dingus Hamilton. Deanna's project was evaluating the effectiveness of emergency department throughput based on provider type in a critical access hospital. Deanna graduated from Hazard Community and Technical College in 2001 with her associates in applied science. After graduation, she began working in a surgical ICU. She moved closer to home to be with family and took a position at McDowell Appalachian Regional Hospital, where she spent 9 years in the emergency department. Deanna was the ED manager, trauma coordinator for 8 years, and in 2017 accepted the position of Community Chief Regulatory Affairs Officer. She was accepted to UK's APRN-BC program in 2016 and completed in 2018. After graduating, she immediately started in the Adult Gerontology Acute Care Nurse Practitioner program. Deanna in 2018 to 2020 was awarded the Pamela Stinson Memorial Scholarship. In 2019, she was awarded the UK Well Care DNP Scholarship. And in 2020, she was awarded the UK Graduate Student Scholarship. Deanna dedicates her work and her DNP project in the memory of her father. Congratulations, Dr. Hamilton. Next is Allie Keogh. Allie's project was care coordination of the geriatric traumatic fracture patient, a multimodal approach to pain management. Allie received her bachelor's degree in biology from the University of Richmond in 2012 and her baccalaureate degree in nursing from the University of Kentucky's second degree program in 2015. Her professional focus has been in critical care nursing, starting in the trauma ICU at the University of Kentucky and continuing her work in critical care at institutions including the Ohio State University and the Cleveland Clinic. Allie currently works in the surgical ICU at Christ Hospital in Cincinnati, Ohio, where she lives with her husband, Ryan, newborn baby boy, Parker, and her dog, Charlie. I have to tell you, Allie did her final presentation on Monday and had her newborn on Friday. So I don't think you can get better planning than that. After graduation, Allie plans to enjoy time with her growing family and will look to start her career in the acute care setting in the Cincinnati or Lexington area. Congratulations, Dr. Keogh. Next is Chelsea McCarty. Chelsea's project was improving multidisciplinary adherence to a daily goals checklist in the ICU, a quality improvement initiative. Chelsea is a Louisville, Kentucky native. She obtained her BSN in nursing and a minor in psychology in 2015 from Bellarmine. She began her nursing career at Norton Hospital downtown in the medical ICU and neuro ICU department. She accepted her first critical care travel assignment shortly after graduation in Denver at Parker Adventist Hospital, after which she accepted a job at Jewish Hospital back in Louisville in the surgical transplant ICU. In 2018, Chelsea started in the DNP program at the University of Kentucky. During her time in the program, Chelsea worked in a graduate teaching assistant position in our undergraduate program. She will be moving to Bellingham, Washington, shortly after graduation with her significant other, Drew Murray, and her dog, Biggie. She plans to be board certified by the ANCC as an adult gerontology acute care nurse practitioner and hopes to continue in academia as a clinical nursing instructor. Congratulations, Dr. McCarty. Next is Needy Moray. Needy's project was an educational intervention to promote medical orders for scope of treatment forms through knowledge and advanced directives in palliative care. 8 years after following her husband to the US from India for his job, Needy decided to pursue her own dream to be a healthcare professional. After she received her associate's degree in nursing in 2014, she started working in a long-term facility and acquired her baccalaureate degree from Indiana University Southeast in 2016. Needy had practiced as a float nurse at Norton Hospital in Louisville since 2015 in multiple specialty units, including orthopedics, neurology, cardiology, and internal medicine. Needy began her journey at UK in the fall of 2018 as a BSN to DNP student. That same year, one of her two sons also started his undergrad at UK. So it's a family tradition at UK now. After graduating, Needy looks forward to beginning her new career with a hospitalist group in the Louisville area. As you can tell, and this does conclude our DNP graduates, and as you can tell from our advisors, they have had to do many switches and turns to complete this degree, and we could not be more proud of them. So at this time, if you can join me in giving a big thumbs up to our DNP graduates, that would be awesome. And then we'll open the mic at the end for applause. Thank you so much.
Thank you, Dr. Melander. I would now like to introduce Dr. Paula Halcomb, President of the University of Kentucky College of Nursing Alumni Association and three-time nursing alum, to recognize doctoral student award recipients made on behalf of the College of Nursing Alumni Association. Dr. Halcomb.
Thank you, Dr. Heath, Dean Heath. The Carolyn A. Williams Award is given to a PhD graduate who has demonstrated scholarly activity at the national, regional, or local level with educational presentations, publications, and/or grant funding for research, who has mentored nursing students and colleagues in the healthcare profession and has demonstrated involvement in professional organizations. This year's recipient presented her exceptional research at the American Heart Association annual scientific sessions and at other important national and regional venues. Her dissertation consisted of 5 instead of the usual 3 publishable papers and has already published 3 of them in high-quality journals. The remaining 2 papers have been submitted. She is an active member of the Rich Heart team at the UK College of Nursing, helping to ensure the success of the Rich Writing Institute each year. She has been an outstanding mentor to other PhD students, assisting them with statistics, REDCap, and Access. In other less tangible ways, has supported their progress with quiet support and assistance. She has volunteered for every opportunity to assist when PhD student input was needed and participated with keen observation. On behalf of the College of Nursing Alumni Association, we are pleased to present the May 2021 Carolyn A. Williams Award to Chen Yin Lin. Congratulations. Our next award is the Sebastian Stanhope Award. The Sebastian Stanhope Award is given to a DNP graduate who has demonstrated scholarly activity at the national, regional, or local level with educational presentations, publications, and/or grant funding for research, who has mentored nursing students and colleagues in the healthcare professions and has demonstrated involvement in professional organizations. This year's recipient is an adult acute care NP who works with the Markey Cancer Center, graduating from the MSN to DNP Clinical Leadership Program. She is also a clinical instructor in the undergraduate program at the UK College of Nursing in the Nursing Care of Childbearing Families course, serving in this role since January 2016, in addition to acting as a preceptor for UK Adult Gerontology Acute Care Nurse Practitioner students. She excelled as a DNP student, taking her work very seriously and always doing more than is required. Her work demonstrates attention to detail and exceptional quality. She is a recipient of the Sigma Theta Tau and Bluegrass Oncology Nursing Society scholarships and is also the program chair for the Bluegrass Oncology Nursing Society and an abstract reviewer for the Clinical Journal of Oncology Nursing. During her time in the program, she completed 3 presentations and produced 4 publications. On behalf of the College of Nursing Alumni Association, we are pleased to present the May 2021 Sebastian Stanhope Award to Holly Chitwood. Congratulations, Holly. The College of Nursing PhD Alumni Award is given to a PhD graduate who has a previous degree from the College of Nursing and who has completed their graduate program with a GPA of 3.5 or greater, supported College of Nursing activities beyond course requirements, demonstrated scholarly activity during their tenure at the college, and mentored other nursing students in the bachelor's or graduate program. As a testament to her work ethic and generosity, this year's recipient continued to work as a productive College of Nursing faculty member, led numerous maternal health service projects, and balanced all of her familial duties during her PhD program. She participated in professional panels for undergraduate and graduate students to share her experiences as a new nurse with many personal challenges and as a graduate student in the College of Nursing at UK. She was selected for the prestigious Robert Wood Johnson Foundation Scholars in Nursing program. This national and rigorous nursing research focused program provides the foundation to develop the next generation of PhD nurse leaders. This individual proactively engaged in numerous scholarship activities, further contributing to the broad dissemination of her work at the local, regional, and national presentations. As the first author, her research was presented at Baptist Health, UK Healthcare Research Nursing's Paper Day, CCTS Spring College of Nursing Scholarship Showcase and Conference, Southern Nursing Research Conference, and the Robert Wood Johnson Scholars in Nursing National Conferences. She published results from her dissertation study, The Effect on Exclusive Breastfeeding in the Nursing for Women's Health Journal. On behalf of the College of Nursing's Alumni Association, we are pleased to present the May 2021 PhD Alumni Award to Martha Monroe. Congratulations, Martha. The College of Nursing DNP Alumni Award is given to a DNP graduate who has a previous degree from the College of Nursing and who has completed their graduate program with a GPA of 3.5 or greater, supported College of Nursing activities beyond course requirements, demonstrated scholarly activity during their tenure at the college, and mentored other nursing students in the bachelor's or graduate program. This year's recipient demonstrated student leadership through involvement as an active member with the Graduate Nursing Activities and Advisory Committee 2019 to 2020. She has precepted many nursing students and has directly mentored working nurses in the clinical setting. She is clearly a change champion with a quiet, firm leadership approach. She is an active leader in her place of employment as an emergency department manager and trauma coordinator for 8 years, and recently accepted a position of Community Chief Regulatory Affairs Officer. She utilized coursework while in the DNP program to examine real patient issues within her institution and has already made significant changes that are affecting patient outcomes. On behalf of the College of Nursing Alumni Association, I am pleased to present the May 2021 College of Nursing DNP Alumni Award to Deanna Hamilton. Congratulations, Deanna. Congratulations to all of the award winners. We will be mailing your award later this summer.
Thank you, Dr. Halcomb, and congratulations to our 4 awardees, Dr. Chin-Yin Lin, Dr. Holly Chitwood, Dr. Martha Monroe, Dr. Deanna Hamilton. Just a few minutes ago, we were celebrating our new generation of BSN nurses. Now we have our new generation of doctoral prepared nurses. Let's give a round of applause virtually to our graduates, please.
Clap.
And I think we can transition to the next slide. Just think, out of more than 4.2 million RNs, you now rank among an elite group with terminal degrees to impact our beloved nursing profession. How fitting it is as we continue to celebrate Nurses Week and the year of the nurse and midwife to know how proud Florence Nightingale would be to see how you are helping to revolutionize healthcare and promote the highest levels of wellness in diverse populations through teaching, research, and evidence-based clinical practice. I offer my gratitude for your commitment to the scholarship of our nursing profession, for challenges you conquered, for scholarly DNP projects and PhD dissertations completed, for the goals you reached and even surpassed, especially during these unprecedented times. You, your families, and your friends should be very proud today and very hopeful for all the possibilities of the future that are open to you. This concludes the recognition ceremony for the University of Kentucky's College of Nursing. Thank you, and I hope to see you at today's commencement ceremony at 3 o'clock at Rupp Arena. Graduates and faculty, we ask that you remain online to review a gratulatory video from our faculty. At conclusion of the video, we will open all microphones so all can be congratulated, especially by your colleagues and your mentors. Jesse, take it away.
Hello, this is Debbie Hampton. Congratulations on your graduation from the University of Kentucky College of Nursing. We know this has been a challenging year that you'll never forget. We wish you the best with your career future.
Congratulations, graduates. You've made it through your journey, and I wish you well. I wish you much peace and joy. I've enjoyed it. It's been a pleasure and an honor.
Congratulations on completing this journey, and I certainly do wish you the same success in all the next endeavors in life and in nursing. Congratulations.
Hello, I'm Deborah Moser. I'm the Assistant Dean for the PhD program. It's my deep pleasure and honor to congratulate you on achieving the pinnacle of education in nursing, your doctorate. Now that you have your doctorate, go out and change the world. You can do it.
Congratulations, graduates. What an exciting time for you and your family. When I think of all the hard work and effort you've put into getting to this point, it reminds me of a quote from C.S. Lewis. Hardships often prepare people for an extraordinary destiny. Your time here at the University of Kentucky has given you tools to do great things, and I can't wait to see the outcomes of your extraordinary destiny. Congratulations again.
Class of 2021, we could not be prouder of all of you and for your accomplishments. You have been in school working on your degrees during the pandemic, which means you've already learned to adapt, adjust, and overcome, only to have to readjust again many times in a short time frame to meet family, school, and work needs. I have witnessed the work that you have achieved, and I can't wait to see what changes you will bring forth during your careers that will benefit our patients and our profession. So it is with great respect for all of you and all that you have accomplished that I say congratulations.
Hi, everybody. It's Julie Marfell. Congratulations. You've waited a long time for this moment, and here you are. Lots of hard work, lots of determination. Go out there, change the world. Right now, nursing needs you, now more than ever. So take care of each other, take care of yourself, take care of the ones you love, and take care of your patients. I know you'll all just do fabulous work. Congratulations.
Hello all. I just wanted to say congratulations. Your hard work has paid off and you finally made it to this day. We are so proud of you for all the endurance and all the time you've spent with us in your journey to come to this day. I just want to say I wish you all success in your future endeavors, and may God's mercy and grace go with you.
Good morning, graduates. I'm Terry Lenny, Senior Associate Dean in the College of Nursing. I congratulate you on this momentous day when we welcome you into the Academy of Nursing. You have earned the highest degree awarded by the university, an accomplishment for which you can be truly proud. I join your family and your friends in celebrating your success. Well done.
We hope everyone enjoyed those words of congratulations from our faculty. Feel free at this time to give a round of applause, take your mics off, and let out a big shout of wahoo. So proud of you guys.
Excellent work.
Congratulations, everybody. Congratulations.
Karina.
Hard work done.
Good job.
Good. Yeah. Enjoy your weekend and enjoy the summer with no homework.
And keep in touch.
Do keep in touch. Yes.